Thank you, Deputy Speaker. Deputy Speaker, sometimes there are motions in this place or debates in this place that frankly reduce the public's appetite and support for our democracy, because what they hear is deception, they hear lies, they hear information or ideas that underwrite or corrode the very integrity of the institution that at least I ran to serve. And the objective of this parliament should and must be to serve the best interests of the people of Australia, frankly with honesty, with integrity, and I would hope that most members would come into this place believing that when they left that our democracy would be healthier, more successful and carry greater trust. And then we get motions like the MPI today. That is built on a lie, a deception, a falsehood about what is happening in healthcare in this country and what this government is seeking to do. And make no mistake, Deputy Speaker, that the objective of this government is to make sure that every Australian, when they walk in, whether it's into their primary healthcare clinic where they see their GP, when they walk into a hospital run by a state government or a private hospital as well, that Australians get the opportunity to get the support and the care they need to live their best lives. And yes, sometimes there's a debate around money, and there is around healthcare. But our focus is and consistently been focused on making sure we get dollars in but outcomes out. And what we have in this motion today is a deception that there is some decline in funding. And in fact, it is the complete opposite, frankly, of what this government has sought to achieve. As you will have heard consistently throughout this government, Deputy Speaker, our focus is on what we can do to grow the economy. But we know that growing the economy is not an end of itself. Growing an economy is good. Yes, there's a larger pie. Yes, it means everybody's standard of living can rise. But it is about delivering a social, environmental, an economic and a human dividend. And a critical part of delivering a human dividend is, of course, providing healthcare provision for the Australian people. And we do this against a backdrop of incredible challenges. Of course, we know that one of the biggest areas of increasing expenditure that faces, regardless, frankly, who is in government, the member for Wakefield, is around the ageing population. People at a time where they need the most healthcare support because the vast majority of healthcare service provision is towards the end of life. It's not just, of course, healthcare directly and getting support and assistance from doctors. It's the increasing costs associated with the aged care and, of course, an increasing dependence on the pharmaceutical benefit scheme, particularly in dealing with managing some chronic conditions. And so at every point, this government is actually delivering precisely what the Australian people need. And it's no clearer than the record amount of investment that is going into the public hospital system. We have increased from 2013 to 14 to 2020-21 by $13.3 billion, but apparently this is a cut. Under the new hospitals agreement, the government has committed an additional $30.2 billion in public hospital funding from 2021 to 24-25, taking overall funding during this period to $130.2 billion. And we know this. In the wonderful Goldstein electorate, we have one of Melbourne's best local community hospitals as part of the Alfred Health Group at Sandy Hospital. Now, the Alfred Health Group has had an increase from $219 million, I should say correctly, $913,309 in 2013 and 2014, up to $318,000 in the last financial year, a growth of $98 million. That's a fair amount. It's been a big increase. But what we're seeing more and more, because of the focus on the economy to deliver for the human dividend, is the amount of money we're able to contribute in increasing access to pharmaceutical benefit scheme so that people can manage their health conditions. And yes, there has been about approximately $9 billion in increased listings in this government. But increasingly, we are seeing new drugs, innovative drugs like Kisqali and the whooping cough vaccine for pregnant mothers being listed as of 1 July, and we should be immensely proud of that.